Hi, and welcome to Fairview Range Focus. My name is Deb Boardman, and I'm the President and CEO of Fairview here in Hibbing. We have a monthly segment that we bring to you that talk about health topics that are important to you and your community. Today, we're visiting with Cheryl Bisping, who is our Community Health Outreach Coordinator for Fairview, and she'll be talking about our Community Health Outreach Program. So welcome, Cheryl.
Well, thank you, Deb, for having me here.
Glad to have you. Why don't you start by telling people what is a community health program?
Okay. Our Community Health Outreach Program was actually a concept that was developed by Fairview in the 1990s, and Fairview Range implemented in 2000. And it works, consists of programs and activities that are conducted by our staff, by our departments, or the Community Health Outreach Department itself. And the goal is to improve the communities we serve through partnerships, prevention, and promotion. And the partnership is really a key to our community health outreach programs. We work with other organizations in the communities. We try not to duplicate our services, but we do like that partnership. We like to share resources and work with organizations that have same goals in mind. And the Community Health Outreach Department also does seek funding for initiatives if there is something needed in the community that is a gap for services. So we try to fill those gaps.
So picking up on that theme, how is it that you go about identifying those gaps or the needs of the communities?
Well, we actually have a Community Health Steering Committee, and every 3 years, hospitals are actually required by the IRS to conduct community health assessments. So our Community Health Steering Committee was involved in the process in 2012 of our community health assessment. So the Fairview actually conducted our needs assessment, and they looked at our qualitative and quantitative data. So they looked at focus groups, key interview stakeholders, and they looked at our web-based surveys of community members. And then the quantitative data, they looked at our hospital admissions, our ER admissions, some of the socioeconomic indicators in our community, and pulled that data together. And then our Community Health Steering Committee looked at that data and prioritized it.
So when you talk about stakeholder groups and key stakeholders, what kind of groups or individuals were those?
Okay. Well, we looked at key leaders in our community. So it might have been business leaders, could have been city councilors, just key people that we, Fairview actually thought would be good fits for looking at what needs we would have and would know what needs were out there.
Okay. So out of that, I assume came some key identified issues?
Yes, so the Community Health Steering Committee actually was very involved in our prioritization. And they actually chose what we would be working on. So they chose heart disease, substance abuse, and depression, and not in any order, of course, but those are the top three items that we will be working on over the next 3 years.
So of those three, do you have a major focus or do you work on all three?
Well, different departments are involved in all three. Heart disease and depression are more other departments in the hospital, although community health can take part in those. But community health is really focusing on the substance abuse prevention issue.
I know sometimes people get confused when you talk about community health versus public health.
Mm-hmm.
Could you define a little bit of difference for that for people?
Sure. Public health is, for the county, we have public health nurses that work out in the community with the WIC program, immunizations, that type of thing. Fairview's community health is I kind of tell people it's like public health for the hospital. Our department actually can do our own assessment. We don't necessarily have to follow where the money is coming down from the government. If we see a need and there's a gap, we can actually fill that. So that's what I really like about working for the hospital, is you can fill the gaps where there are needs that the government isn't covering.
And I know just by example, because I've been down to your offices, that you also work with other agencies like the Minnesota Safety Council and others like that. And one of the programs I know that you run, because I see them sitting there all the time, are the car seat program.
Yeah, and so that, I work with UCare Insurance also has a program, and the Minnesota Department of Public Safety Office of Traffic Safety, because we do have a lot of low-income people with children, and we do want to keep them safe. So they actually provide us with car seats. I do have to write a grant to receive the car seats, but I can give out car seats to low-income families if they meet the income guidelines.
And so how do they go about qualifying? Does that happen at the hospital, or do they talk directly with you and your department, or how does that connection get made?
They sometimes they're referred to me by public health or other agencies in the community, but they call me directly and I talk to them and figure out where their income level is, and then they meet with me one-on-one. They have to go through an education process and fill out, some income papers. But yeah, so it's a one-on-one. It takes about an hour to go through the education with them.
Well, it's a great service for sure.
Yes, it is.
So let's jump back, and why don't you tell us a little more about the work that you're doing on substance abuse prevention? I know that's a key issue that the community health program has focused on and is very vital to our community.
Right, so I actually work with two coalitions that focus on substance abuse. One is the Mesabi Safe Communities Coalition, and they focus more on the traffic safety part, but there is some interplay with substance abuse on there. And then I work with the Hibbing Chemical Health Advisory Committee, and they do focus on substance abuse prevention. And because we have a high rate of alcohol-related issues up on the Iron Range and in Hibbing, we did receive funding for both of those coalitions to work on substance abuse prevention.
So what type of members do you have on those councils?
Well, our Mesabi Safe Communities Coalition, we do partner with law enforcement. That is part of our requirement with our state grant. So we have a lot of law enforcement. We have county sheriffs, our state troopers, we have our local PD. We have traffic engineers we work with, because the mission of that group is to reduce injuries, serious injuries and fatal crashes in St. Louis County and across the state. So it's through education, which is our role as community health, enforcement, which is law enforcement, engineering with traffic engineers at MnDOT, and then emergency medical services. So we all work together. We have community members, citizens, just all kinds of sectors are represented in our coalition for that.
So a lot of great input from the right people.
Yep.
How about your Chemical Health Advisory Committee?
That group started in 2009. And that started with maybe a dozen people that were concerned about the issues we were having in our community around chemical health. It has now grown to about over 50 people. We have like 12 different sectors. We have, again, law enforcement, schools, religious groups, teachers, parents, just, a big wealth of people that are involved. And that group, actually, the more work we do, the more it continues to grow and more people call and want to be part of.
Well, that's a good point. So if someone has an interest in serving on some of these committees or providing input, how do they go about doing that?
Well, we do have, my phone number is out there. It will be at the end of the show as well. But they can call me directly. They can email me. We do have two Facebook pages, so both the coalitions have their own Facebook page. You can go through the community health link on Fairview Range's website to get to those, but they certainly can call or email me.
Okay, great. I know that you leading the committee and working with the committee, have done a lot of work in the community on the Chemical Health Advisory Committee. Why don't you talk a little bit about some of the things that you've been doing to try to address that issue?
Sure. So We have done quite a bit in the past before our grant, which I'll talk about, but we have worked with the city on our social host ordinance. That was back in 2010 when that was adopted. We've done outreach with prescription drug abuse prevention, the synthetic drugs recently, alcohol prevention. But what recently we wrote a grant to work on underage drinking and binge drinking issues in the community, and we received funding from the Minnesota Department of Health and Human Services, their Alcohol and Drug Abuse Division, to work on. It's a really long and cumbersome name. It's called the Strategic Prevention Framework State Incentive Grant. So we call it SPIF-SIG, just because it's a mouthful to try to say.
Okay.
So we do have a full-time coordinator that works just on that grant. So she's trying to reduce our 30-day past alcohol use for our 6th through 12th graders, and she's working with the community to try to reduce binge drinking among our, I think it's our 9th through 12th graders, and then our 18 to 25-year-olds. So doing a lot of work on alcohol prevention in the community.
So when you talk about that, you talk about the past 30-day alcohol use among 6th to 12th graders, and then another statistic for 9th through 12th. How do you get those statistics?
Well, okay, so phase 1 of the grant required us to really assess our community. So we had to pull data from Minnesota student surveys out of Hibbing, because we are focusing just on Hibbing for this grant. So we looked at the Minnesota student surveys. We also conducted other assessments. We did a community survey when we first received the funding. We just did a follow-up survey because we didn't feel like we had enough of a response to that survey. And just because of some of the work we started doing, we had a little pushback, and we wanted to know, okay, what do people really think? So we did a lot of assessment, and then from that data, we did some planning. Okay, where are we seeing the issues from our data? What do we need to work on? And we planned strategies on how we were going to do that. So that was phase 1, and now we are in phase 2, which started July 1st. So phase 2 is actually implementing all of those strategies, and like 80% of our strategies have to be evidence-based. So what that means is that there had to be some kind of research done that these strategies are proven to work on reducing underage and binge drinking. So a lot of what we're doing is evidence-based approach because, you know, it is a grant and we want to make sure we're getting results. So we're also following that up with evaluation. So what we're implementing, we have to evaluate it consistently along the way to make sure we're doing what we're supposed to be doing and that it's working. And if it's not working, why not? And make a fix for that.
So I know I'm putting you on the spot here because you don't have the numbers in front of you, but do you have any numbers that you could share with us when you talk about 6th to 12th graders or 9th to 12th graders?
Yeah, I don't have the numbers right in front of me, and actually we are waiting for the schools to give us permission to look at the most recent Minnesota student survey. So the numbers that we based our data on was the 2010, and so we know we have different, you know, youth in our school and different things going on. So we're really waiting to get those numbers and those results. So they should be coming soon.
So this Minnesota student survey that you're talking about isn't something that's run by our community health program. This is something that's done throughout the state?
Right. This is required by the Department of Education, I believe, and the schools participate them throughout the state. And they're conducted every 3 years. They recently, I believe, changed what grade levels get surveyed. So it's kind of been changed, so our numbers might be a little off when we go back and look at what we're comparing to earlier. Some of the questions may have changed, but yeah, it's a state survey that's conducted every 3 years in the schools.
And part, I would assume that's how you get some of your comparative data about what issues are the big issues in our county compared to others?
Right. You know, in my job and my role as a community health outreach coordinator, I look at this Minnesota student survey data for Hibbing. I've looked at Chisholm's. I've looked at Virginia. I've compared St. Louis County. I've